Welcome everyone. Welcome to the Forgotten Trimester. This is a YouTube channel dedicated to the education of pregnant and postpartum people on all things fourth trimester. I am Dr. Megan Gray. I am a board certified practicing OBGYN and mom of two little ones. In today's episode, we are going to talk about all things pooping after your C-section. Yes, so I get a ton of questions about bowel movements after C-sections. We get a little hyper-focused on it, but that's okay. That's so normal. So let's talk about it. So most people aren't going to have a bowel movement right after their cesarean section for several reasons. They have had, depending on the type of anesthesia they've had, depending on the amount of bowel manipulation during the cesarean section, depending on how their bowels normally function prior to pregnancy or cesarean section, will also have an effect on how often or how soon after your cesarean section you will have a bowel movement. So do not fret if you've not had a bowel movement in the first couple days after your cesarean section. Most people will take about 5 to 7 days after their cesarean section to have a bowel movement, but certainly some people can have bowel movements sooner. If you are a person that suffers from chronic constipation or complications such as IBS, IBD, Crohn's disease, or ulcerative colitis, those might have an effect on how your bowels move after your cesarean section. So that's something to talk to your physician about as well. So what kind of tips can we have to make that first bowel movement a easy one, right? So everyone wants to know, how can I not strain or pop my stitches or be scared of my first bowel movement after my C-section? So there's several things you can do. Number one, get up and move as soon as possible after your cesarean section. So usually people will get up within the first 12 to 24 hours. The more often you get up and move around in the first 12 to 24 hours, the better off you'll be. That'll help your bowels remember that they need to move. So bowels move in a linear fashion with constant contraction and relaxation along the length of the bowels to help push things along. So reminding your bowels how to move is one way, so getting up and moving around. Number two, chewing gum. I know that sounds funny, but there are studies to show that people that chew gum in the immediate post-operative period, so after cesarean section, their bowels will tend to move better and sooner. So it tells your brain to remind your bowels to move things along the length of your bowels. Number three, drink plenty of water. So sometimes we haven't had a whole lot to drink prior to our cesarean section, depending on how we got to our C-section. A lot of people labored for a long time prior to their cesarean section, and they have not been drinking a lot of fluids. So it's important in the postpartum period to start drinking plenty of fluids. We all know that constipation can occur when we get dehydrated. Water helps the bowels process all of the food, and it bulks up the stool and makes it softer. So getting plenty of water to the point where your urine is nice and clear will help your bowels process and move things along. Number three, include foods that have magnesium. So bananas or sports drinks that are low sugar can help increase your magnesium stores in your body. Magnesium helps with gastric and bowel motility, and will encourage your bowels to continue to move. Next is take the lowest dose of narcotics necessary to manage your pain. So some people after their cesarean section will require stronger pain medications than just Tylenol and ibuprofen. And frequently we'll take narcotics, but narcotics can be constipating. So if you can reduce the amount and the frequency of your narcotic usage, that will reduce your risk for constipation. Next up, be sure to eat high-fibered foods. particularly insoluble fibers. So whole wheat flour, wheat bran, beans, nuts, those are a few things that you can eat that are insoluble fibers. They are known to increase stool bulk and will make passing bowels easier and reduce your risk for constipation. So to recap, get up and moving, chew gum, take the lowest dose of narcotics as necessary, include foods that in your diet that have magnesium, stay well hydrated, be sure to eat fiber-rich foods, and one more thing, take a stool softener. So I love Colace and Miralax. They're easy to take. Colace is a little pill that you can take once or twice a day. Miralax is a substance that you mix into your water, so it encourages you to drink water. It doesn't have a flavor or anything like that. It goes down very easily. You can't taste it. You can't feel it. There's no grittiness to it. But they soften your stools. They are not laxatives, so they don't increase the motility necessary of your bowels, but they will increase stool bulk and make it softer and easier to pass. So those are my tips and suggestions for your first bowel movement. I promise it won't be as scary as it seems. A lot of people are so worried about popping stitches with their first bowel movement. It would be really hard to do that. You would have to increase your intra-abdominal pressure, so that pressure you build up when you're bearing down really significantly to do that unless there's already a defect in those stitches, which is extremely rare. So I don't think that should be one of your worries. And if you follow those 7 tips, I think your experience will be okay. So I hope this helps. If you like what I'm doing, please give me a thumbs up and follow me and share the word. Have a great day, guys. Bye.